Welcome, everyone, to Moving Toward Health Justice in the COVID-19 Era, a sampling of U.S. Public Libraries' efforts. My name is Brian Medina. My pronouns are Z, here, and heres. I am a non-binary person with long, brown, curly hair and dark brown eyes. I have dangling, multicolored earrings and have a white dress with blue and orange designs. My background reads Black Lives Matter. I'm grateful to be in virtual space with each of you today, and I'm also honored to be your moderator for this session. We also wanted to thank our sponsors, the University of Maryland Libraries, and the Graduate School's Office of Graduate Diversity and Inclusion, or OGDI, at the University of Maryland. Pursuant to Maryland law, we are required to provide verbal or visual notification of recording. If you continue to participate after being notified that the activity is being recorded, your consent to recording is implied. Accessibility services are gratefully part of this session. American Sign Language Interpreter's video will be displayed during the entire session. Attendees can pin videos or remove interpreters from their screen. For a better viewing experience, we recommend that you use a desktop device versus a mobile app. Zoom captions will be automated, or you can view them in a separate window on your device by selecting the link in the chat. Cart service can be enabled by selecting closed captioning feature located on the bottom bar within the Zoom screen. Please post all questions in the chat. We will select a representative sample of these questions for our presenters to answer at the very end in order to conserve time. Now I'm delighted to welcome our presenters to introduce and describe themselves, and if you could also describe any images as they're being presented on the screen.
Thank you so much, Brian. I'm going to go ahead and share my screen and then we'll get started. Okay, so hello everyone, and thank you for joining us. My colleagues and I will introduce ourselves and then present the paper we published recently in Library Quarterly titled Moving Toward Health Justice in the COVID-19 Era, a sampling of U.S. public libraries' efforts to inform the public, improve information literacy, enable health behaviors, and optimize health outcomes. My name is Morgan Adle. I use she, her, hers pronouns, and I am a PhD student at the University of Maryland's College of Information Studies, where I also completed my Master's of Library Science. And Jane, if you want to introduce yourself, and then Brian and Beth.
Sure. Hi, everyone. My name is Jane Behre. I use she, her pronouns. I am also a PhD student at the College of Information Studies at the University of Maryland. And also, like Morgan, I also got my MLIS right here at University of Maryland. Visual description, I'm a white woman with shoulder length, darkish blonde hair. I'm wearing gold hoop earrings. I have tortoiseshell glasses that are black and white and blue. I'm wearing a black shirt. My background is my very messy bookshelf and an art print right behind my head.
All right. Hello, everyone. I am Brian Reel. I am an assistant professor at the School of Information Science at the University of Kentucky. I am coming to you from my campus office at the University of Kentucky. I am a white man with short cropped orangish hair and a beard, and in an office with a few framed library related pictures in my background and getting hit hard by fluorescent lights.
Hi, everyone. My name is Beth St. Jean. I'm an associate professor at the University of Maryland College of Information Studies. Thank you very much for coming, everybody. My pronouns are she, her, hers. I am a white woman with white hair. My background on Zoom is a University of Maryland building. I'm not sure which one. And I have a bright purple shirt. Thank you.
Thank you all. I'll go ahead and get started with our presentation. So the COVID-19 pandemic both illuminated and intensified health disparities in the United States. Public libraries and librarians around the world responded nimbly and innovatively to this evolving, unprecedented health crisis by adapting existing and developing new resources, programs, and services to address the public's need for information and beyond. In this study that we conducted, we sampled American Libraries' COVID-19 related offerings, which included providing access to reliable information and information technologies, information literacy training, programs to improve people's mental and physical health, and resources enabling people to engage in important health behaviors such as wearing masks and self-testing. Some libraries offered programs focused specifically on health disparities and racism experienced by particular populations. We then categorized each library offering that we found in terms of whether it contributed to improving equality, equity, or justice for patrons and the public. Our exploratory study revealed that library offerings span the entire equality, equity, justice continuum, with relatively fewer offerings falling into the justice segment, suggesting the importance of further investigations into such initiatives. As the COVID-19 pandemic started and continued on, libraries across the country adapted existing programs and developed completely new initiatives to better serve the public's evolving needs. For example, when libraries closed their physical spaces, they began offering virtual programs, curbside pickup for checking out and returning books, and even extended Wi-Fi into their parking lots so that the users could access the internet with their personal devices. The number and breadth of programs and services being offered continued to increase and evolve. Our study collected a snapshot of these offerings to record just how much libraries were doing to adapt their services. But it is important to recognize, however, that early library offerings, especially virtual offerings, were not as accessible as they are now. Platforms like Zoom and Facebook Live did not have many of the accessibility features they have today, and only updated their tools after weeks to months of the pandemic and quarantine. In April of 2020, for example, Facebook Live added audio-only mode, automatic closed captions, and logged out support so that users without Facebook, internet, or a computer could call in to listen to content. The video conferencing platform Zoom didn't add auto-generated captions until October 2021. So while libraries were able to deliver their programs and services virtually in many cases, they were not accessible to everyone, especially users with disabilities and users without in-home internet access. And the slide that I have up now includes an image shared by the Prince George's County Memorial Library System on Facebook that advertises their Drive Up Wi-Fi initiative. It says, "Need Wi-Fi? Stop by a branch library to access free public Wi-Fi from outside." There's also an image of a car with books surrounding it that says curbside pickup, and a picture of grab and go activities provided by the Darien Children's Library in Connecticut in 2020. They offered patrons Lego challenge kits that they could take home and complete since the library space was closed, and these types of programs could not be offered in-house. Libraries also began developing programs and services specifically related to health and COVID-19. While buildings were closed to the public, some libraries utilized their makerspaces and 3D printers to make personal protective equipment that was in critically short supply for healthcare workers, including parts for face shields, surgical masks, and N95 respirator masks. Other libraries donated their 3D printers directly to hospitals so that the hospitals could design and build their own devices and parts as needed. Libraries also did their part to enforce mask wearing mandates and encourage their users to get vaccinated. Many libraries helped patrons, especially seniors, register for and schedule their vaccinations. They also partnered with local and state health organizations to organize vaccine clinics. And in addition to encouraging health conscious behaviors, libraries offered information to encourage health literacy. While libraries regularly develop and offer programs and services to teach information literacy and health literacy, a number of libraries also created COVID-19 specific programming aimed at educating patrons and minimizing health disinformation. One such example is included in this slide. The Newark Public Library hosted a virtual panel with a medical doctor and vaccine trial participant titled COVID-19 Vaccine, Facts versus Myths. The poster says, "Hesitant about getting the vaccine? Worried about the vaccine after effects? Join us for a discussion on myth-busting facts about the COVID-19 vaccine." The images on this slide also include an advertisement that reads, "Free COVID-19 vaccine clinic at Lancaster Public Library. Vaccines administered by PA Department of Health. PA unites against COVID." Now, the study that we conducted, our team collected over 80 examples of library programs and services that were offered between March 2020 and March 2022 by searching through library-specific websites like the ALA's, the American Library Association's Programming Library and blog, or Facebook groups for librarians, and by conducting online searches using keywords such as public libraries and COVID. We included a range of examples from all over the United States and from libraries that range in size and funding. We then categorized the offerings by what type of service they were ultimately providing, and these categories include providing physical access to information and information technology, providing intellectual access to information, information literacy, and health literacy, supporting physical and mental health and well-being, informing, facilitating, and enabling health behaviors, safe spaces and maker spaces, and serving vulnerable populations and health justice. This list not only illustrates the wide range of services public libraries offer, but also highlights patrons' needs during the COVID pandemic. Library patrons needed physical access to technology like laptops and printers, safe spaces that met their needs, and assistance finding and understanding information. Libraries also became a place to focus on mental and physical health during the extended quarantine period. And while libraries always serve as a place to help users access, find, and understand information, during COVID, there was a new emphasis on health-related information, especially on the truths of health, medicine, and vaccines. We also identified a shift in the types of programs offered over the 2-year pandemic period. Towards the beginning, library programming was focused on community support and finding ways to continue to offer existing programming and services and combating general COVID misinformation. Efforts then shifted towards vaccine registration and combating COVID vaccine-related misinformation as vaccines started to become available. Then, as vaccine distribution became more widespread, libraries not only helped patrons to access vaccines by hosting vaccine clinics or helping them register for appointments, but they also addressed vaccine hesitancy through health literacy programming. Libraries not only provided physical access to health services, they also encouraged their communities to engage in positive health behaviors through education and the strict enforcement of government vaccine mandates. Increasingly, there has been immense pressure put on libraries to provide programs and services that ensure that communities, especially marginalized and at-risk populations, have equal access to health information and services. And Jane, I will turn it over to you. Just let me know as you need me to advance slides.
I will do that. Thank you. So now we're going to provide several examples of library programs and services that fall into each of the categories that Morgan just outlined. So first is physical access to information and information technologies. This could look like curbside book checkouts, /returns, and local delivery, internet access to communities through buying and distributing Wi-Fi hotspots to patrons, boosting Wi-Fi signals so patrons could access the internet from their parking lots, and repurposing bookmobiles as Wi-Fi hotspots. The Cedar Rapids Public Library Executive Director said that their libraries were, quote, forced to close as the number of positive COVID-19 cases climbed in the early weeks of the pandemic. The library had to address how to get its hard copy materials into the hands of those who needed them, and that's where the curbside pickup started. It was something that our patrons had wanted for a while now, and we were still figuring out how to implement it. But when the pandemic hit and we had to close, starting a curbside pickup service became crucial, end quote. And again, that's from the Cedar Rapids Public Library. And the Ada Public Library in Oklahoma also talked about how, quote, during COVID, the library helped a residential community that serves adults with developmental disabilities by providing a Wi-Fi hotspot so they could do programming virtually. Before the pandemic, the community came to the library once a week, and the hotspot helped maintain these visits virtually and combat feelings of isolation, end quote. Next slide, please. All right, so now we're going to talk about intellectual access to information, information literacy, and health literacy. And the programs and services that fall into this category include programs or clubs to help people understand and navigate the pandemic. So examples of these programs include How to Spot Fake News, the COVID-19 edition from the Denver Public Library, Honest Talk about the COVID vaccine from the Calvert Library in Maryland, and Medical Knowledge versus Misinformation from the Tacoma Park Public Library and DC Public Libraries. We found numerous programs that focused on helping to combat the deluge of COVID-related misinformation and disinformation that was circulating. The World Health Organization Director General labeled this as a, quote, infodemic, where so much information is circulating, both accurate and inaccurate, that people can't find trustworthy information when they need it. And we'll talk about the infodemic more a little bit later. The Denver Public Library put out a statement about how, quote, in this time of COVID-19, we have two types of viruses to worry about. We have all become familiar with the immediate physical threat to our health that has us washing our hands often, practicing social distancing, and more recently donning cloth face coverings. Context, this is a quote from like the middle of 2020, so a little bit of context there. Continuing on, but COVID-19 puts us at risk for more than just physical illness. Inaccurate and incomplete information about how the novel coronavirus can spread just as rapidly, making us vulnerable to misinformation. They go on to talk about how in 2017, they had a how to spot fake news program that they went on to adapt in 2020 to be their COVID-19 edition. The director for the Institute of Museum and Library Services, or IMLS, also spoke about the, quote, unvaccinated areas of the country are the places where the infection rate is going up, the hospitalization rate is going up, and a lot of it is a result of either misinformation or a lack of information or just a general decision to stay away from vaccines until we know more. But we do know enough, in fact, so if we can get the information from trusted sources like libraries and museums out to folks, we think this could have, as it has in some communities already, an impact on vaccine rates and therefore on our getting out of the pandemic sooner rather than later, end quote. Next slide, please. So now we'll talk about supporting the public's physical and mental health and well-being. When we talk about that, we're mostly talking about public libraries supporting people's physical, mental health and well-being by sort of what Morgan has already talked about, using their 3D printers to print PPE, distributing N95 masks, offering free at-home COVID tests, hosting communities for immunity, vaccine literacy, and trust information sessions, producing podcast episodes to maintain community ties, hosting story times, offering take and make craft programs, running free online yoga classes, and offering stress management workshops. The IMLS blog made a post discussing how, quote, in recent years, many librarians have gradually taken on other functions well beyond lending out books. They've become ad hoc social workers and navigators. They help members figure out the complexities of life, from navigating the health system to helping those with housing needs. Over the past 7 months, local libraries reinvented the way they deliver services within their communities. Recently, many have found ways to provide reprieve and support to community members as they strive to manage and maintain their mental health through the pandemic, end quote. And again, that is from the IMLS blog. Next slide, please. So moving on to talk about informing, facilitating, and enabling health behaviors. Some public libraries hired community health workers to offer health education programming, connect patrons with relevant and reliable health information, facilitate telehealth appointments, and so on and so forth. They've also offered programs to help debunk misinformation and inform the public about the importance and trustworthiness of COVID-19 vaccines. Many libraries have gone beyond providing information by distributing masks, test kits, helping seniors sign up for vaccination appointments, and hosting testing and vaccine clinics. Some public libraries' enforcement of government mandates positively influence patrons' behaviors. So, for example, the Fairfax County Public Library in Virginia designed a campaign to encourage reluctant patrons to keep their masks on while in the library. The library's graphic artist designed 4 signs that show famous book covers, literary characters, and other figures that include the caption, "Smile with your eyes," and a reminder message about the importance of properly wearing a mask. The image on this slide is one of those signs featuring a portrait of the artist Frida Kahlo on a yellow background wearing a mask with the caption, "Smile with your eyes," and information about the library's mask policy. The Hawaii State Public Library System's requirement that patrons either show proof of vaccination or a negative COVID-19 test generated pushback similar to that caused by many mask mandates. However, it also protected the health of library employees and patrons, and even convinced some patrons to go ahead and get vaccinated. So one patron shared, quote, "I was one of those who said I wasn't going to get vaccinated, but the library changed my mind. I like going to the library, and when I went there, I found out I needed to be vaccinated. I'm okay with that," end quote. Next slide. So libraries also created or used safe spaces and makerspaces. A survey by the Public Library Association found that 99% of libraries closed their physical spaces, but libraries utilize outdoor spaces for services. So for example, the Hawaii State Public Library System and the Greenfield Public Library in Massachusetts provided laptops and printers on the lawn for patrons who needed to use computers while the library was closed. And libraries also used things like story walks to help engage with their patrons. And some libraries continued to use their spaces and tools to help their communities, such as by making PPE to donate to hospitals like the Billings Public Library in Montana. But libraries are also recognizing the value of outdoor spaces and integrating them into building redesigns. So again, for example, the New City Library in Rockland County, New York is renovating and expanding their space to feature outdoor spaces, including courtyards and a makerspace terrace. Libraries also utilize online spaces for virtual programming. So the Public Library Association explains how, quote, many librarians have turned to YouTube, Facebook Live, and other services in order to create virtual programming. However, many libraries across the country and around the world are bringing story time outside in a way that is safe, fun for the whole family, and encourages a healthy lifestyle through story walks, end quote. And next slide, please. So lastly, talking about serving vulnerable populations and health justice, some libraries offered programming that recognized COVID's disproportionate impact on particular communities. Examples of these programs include COVID-19 and racial justice, responding to dual pandemics from the Howard County Library System, African-American clergy and community conversation on COVID-19, hosted by the Prince George's County Memorial Library System and conducted in partnership with the University of Maryland School of Medicine, community resiliency, health promotion for Asian Americans, and combating anti-Asian racism from the Montgomery County Public Libraries, ending homelessness during the pandemic, also from Montgomery County, the shadow pandemic, gender inequality in the wake of COVID-19 from Prince George's County Memorial Library System, and basic COVID ASL signs from the Frederick County Public Libraries. But the American Libraries magazine put out an article about how COVID protocols may have affected patrons with disabilities. It discusses how, quote, the pandemic has also pushed much in-person library programming online. For some patrons with disabilities, that change represents a mixed bag, end quote. The article talks about how the pandemic slowed certain services like the National Library Service for the Blind and Print Disabled's free service that mails Braille and audio materials to people with low vision, blindness, and other disabilities for whom printed materials may be inaccessible. It also mentions how the closure of physical library spaces also affected in-person programming for children with disabilities, such as the Arlington Public Library's weekly playgroup for this population. And now I'm going to hand it off to Beth, who's going to talk a little bit more about health justice.
Okay, thank you very much, Jane. So as Morgan mentioned early on in our presentation, the COVID-19 pandemic has both illuminated and intensified health disparities. And one of our fundamental motivations in conducting our investigation was to identify the ways in which U.S. public libraries were helping with issues around COVID-19 relating to limited health literacy among the public and the health injustices that were unfolding all around us. On the slides, there's a few definitions. The first is a definition of health justice by the San Francisco AIDS Foundation, when everyone has the power to make decisions about their body and their health. The next definition is by the CDC. The related term health equity is the state in which everyone has a fair and just opportunity to attain their highest level of health. And the last definition, the Network for Public Health Law defined health justice as dismantling the effects of racism and working toward sustainable policies and innovations that will last through generations. And they specify it's about ensuring that everyone has what they need to be healthy. At its core, health justice is about ensuring everyone has the resources and opportunities they need to live a long and healthy life, but these needs are different for different people. And health justice at its very core is about dismantling any and all barriers that can keep people from reaching the best possible health outcomes for them. And it's making sure people have access to anything and everything they need to do this. And chief among these resources is information and information literacy. We have a large problem of very limited health literacy in the US among adults. The most recent study found that nearly 90% of adults in the US have a below proficient health literacy level, and these more limited health literacy levels are more prevalent among people who are disadvantaged in one or more ways. And the problem with this is that limited levels of health literacy strongly correlate with poorer self-reported health, less likelihood to get preventative health care, greater use of emergency health services, higher hospitalization rates, and poorer health outcomes. So if health justice is just not possible without health information justice. So if people lack access to health information that's understandable, relevant, trustworthy, and actionable for them, they'll have a drastically reduced ability to live a long and healthy life. Next slide, please, Morgan. So we took these various offerings that we found, and we tried to think about, okay, where do these fall along this this continuum from equality to equity to justice? So the image in the slide shows a soccer game, and 3 people are watching the soccer game. In the leftmost box, it's labeled equality. So the 3 people all have the same size box to be able to see over the fence and be able to see the soccer game. So the taller people, that helps, but the shorter people still can't see it because the box doesn't provide enough height to them. So that's equality, where there's an assumption that everyone benefits from the same support. In the middle box, we have equity, where everybody gets the support they need. So the children get a larger, taller box, and the adults either don't need a box or they get a smaller box. So that is equity. Everyone gets the support that they need. And then in the final box, we have justice, where the fence has been, it was a wooden opaque fence. It's been replaced with a chain link fence. Everybody can see through it. So the barriers have been removed. So that's justice. Everybody can see the game without any accommodations because the cause of the inequity was addressed. So we were wondering like how the programs and resources we public libraries were offering, where they kind of fit along these this continuum. And so an example of equality might be a one-size-fits-all offering, such as, hey, come into the library and you can have free Wi-Fi access. Well, that assumes that everybody has the devices and the skills necessary to benefit from that. And then the next step along the continuum, equity, realizing that different people need different types of support. So going out into the community, where bookmobiles are offering Wi-Fi out into the community, that helps people who can't get to the library. They can still benefit from that. And then moving all the way to the end, justice, trying to address the root causes of inequity and remove any and all systemic barriers. An example of that is offering digital literacy training programs for everyone, free in-home Wi-Fi for everyone, mobile vaccination clinics, making these types of services available to all, advertising them to all so everybody knows about them, can access them, and can benefit from them. Next slide, please, Morgan.
Beth, we're almost out of time. Are you okay with us skipping the infodemic portion and letting Brian talk about future research? Brian, is that okay with you as well?
I can do that.
Perfect, thank you.
I'll just skip ahead. Sorry about that, Beth.
All right. So to wrap up, we did the study of library programming during the pandemic. I've done some other research on this. A few others are kind of pursuing this space. But there's a lot that we don't know that we need to figure out. We need to figure out whether a lot of library programming became accessible in theory or actual fact. And of course, libraries often operate independently. There's more than 16,000 library buildings in the US. Many of those are systems of one or just a few that make their own decisions. So future research should address things like, we know that a lot of online programs had the potential to reach more people who have specific accessibility needs, but did they actually do that? Were libraries actually trying to target this sort of thing intentionally? Did libraries design programs to be accessible, or did they rely on auto captioning and other automated tools? So we have this issue of how much intentionality was here. That I've spoken to some librarians who understand that, yes, there's a lot of people who cannot get into libraries regularly, who can get on Zoom and so forth. But we're not seeing much out there in terms of how many libraries marketed programs as such and tried to reach more people. Morgan mentioned auto captioning becoming part of different platforms. So we have some by default accessibility that isn't necessarily, that great, but it's something. We kind of need to know if it's enough. And I think we have some of that answer, that we know that we need some more intentional captioning, some more intentional accessibility tools for library patrons. But there's also the risk of many libraries thinking that these auto captioning tools and so forth are enough and not looking to pursue more themselves. So we need to figure out how to have conversations and advanced libraries in this space. Morgan, I'm ready for the next slide. And it's just a matter of, we've seen a lot of great programs. What's going to last? We saw a massive uptick in community health programming, mainly related to the pandemic, but also a lot of intersectional, looking at other health behaviors that have to do with the pandemic, but also are related, have more broad implications. Are public libraries going to keep engaging with community health to this level, keep engaging with their health departments, keep arranging these outreach programs once the pandemic is over, or are we going to lose that momentum? We saw an increase in programming around social and racial justice, especially at the height of the Black Lives Matter movement and the protests around that. We know that libraries will keep this up to some degree. We just don't know how much. And again, there is a risk of the momentum being lost because people are not currently out on the streets to the same level. For online programs, how many are going to stay online and how many will just go back to being fully in person? An example I have is from some research that I did separate to the study, is a lot of public libraries have started to do online book discussions that they did not have before. A few libraries have said that they're going to move back to primarily in person, but when they get a snowstorm or something like that, they'll just shift to online instead of canceling. But in general, we need a better idea of who libraries were suddenly reaching with the shift to online, who they were connecting to with this new programming, what was worth keeping from all these changes, and find ways to work with libraries to give them the support needed to keep this momentum in certain spaces. And with that, I think that we're ready for questions.
Thank you, one and all. It was a wonderful presentation. We have several great questions in the chat, and I'm going to start with one that was upvoted a few times to hear if they're interested in any libraries or continuing with masking or filtration, other COVID initiatives like curbside pickup to provide an accessible environment, or if all mitigation efforts have been abandoned. This is for anyone.
Let me address curbside real quick, if that's okay. So I did a separate research study when I was up in Connecticut at the request of the state library on some digital inclusion activities during COVID and some of the other services that libraries are offering. And this was I launched a survey in fall 2020. It ran into early the next year. And curbside pickup was one of the most popular programs added. However, I had a question built in on what do you know you're going to be getting rid of when the pandemic is over, back when we were still using that sort of phrasing instead of going into an endemic. And one of the most common responses was, we're getting rid of curbside pickup. It's time intensive, it's labor intensive, it is one of our most popular new programs, but we do not have the resources to sustain it. And that speaks to a lot of what we're going to be seeing in the next couple of years, is now that we're getting back to more and more in person, libraries have all these online services that they were doing that they were able to do because they had extra time and resources from shutting down their building or having it open limited hours, limited access. A lot of libraries will not be able to keep all the online stuff going with the resources they have now that in-person is back.
We're sadly right at time. There's still a few questions in the chat if any of the presenters wish to share any insights directly in the chat window. But otherwise, we'd like to thank you and embrace and appreciate all the wisdom that you have shared about this topic, about libraries, and a personal interest for me as my partner is a public library staff member. Thank you so much. Thank you all for attending as well.
Thank you.
Thank you.
Thank you.
Thanks.